Snoring is a common issue that affects many individuals, causing disturbances during sleep and leading to various health concerns. It is characterized by the harsh and loud sound produced during sleep when air flows past relaxed tissues in the throat, causing them to vibrate. While snoring is often dismissed as a minor annoyance, it can have significant effects on both the snorer and their sleep partner. Snoring occurs when the flow of air through the mouth and the nose is partially obstructed during sleep. It can be caused by several factors, including obesity, nasal congestion, alcohol consumption, sleep position, and anatomical abnormalities. To combat snoring and improve the quality of your sleep, consider implementing the following techniques. Maintain a healthy weight. Excess weight can contribute to snoring by narrowing the airways. Engaging in regular exercise and following a balanced diet can help you shed those extra pounds and alleviate snoring. Sleep on your side. When you sleep on your back, the base of your tongue and the soft palate collapses to the back of your throat, leading to snoring. Try sleeping on your side to keep your airways open and reduce the likelihood of snoring. Elevate your head. Elevating the head of your bed or using extra pillows can help keep your airways open and prevent snoring. This position can help reduce the obstruction of airflow and alleviate snoring. Avoid alcohol and sedatives. Alcohol and sedatives relax the muscles in the throat, increasing the chances of snoring. Refrain from consuming these substances in the hours leading up to bedtime to prevent their impact on snoring. Keep your nasal passages clear. Nasal congestion can contribute to snoring. Use saline sprays or nasal strips to keep your nasal passages clear and promote unobstructed breathing. Stay hydrated. Dehydration can lead to the production of thick mucus, which can block the airways and cause snoring. Drink plenty of water throughout the day to stay hydrated. Use a humidifier. Dry air can irritate the throat and nasal passages, leading to snoring. Using a humidifier in your bedroom can add moisture to the air, reducing the likelihood of snoring. Quit smoking. Smoking irritates the tissues in the throat and can contribute to snoring. Quitting smoking not only improves your overall health but also reduces snoring. Practice good sleep hygiene. Establishing a consistent sleep schedule, creating a comfortable sleep environment, and adopting relaxation techniques can improve the quality of your sleep and reduce snoring. Use anti-snoring devices. There are various anti-snoring devices available in the market, such as nasal dilators, chin straps, and tongue-stabilizing devices. These devices aim to keep the airways open and minimize snoring. Consider oral appliances. Oral appliances, similar to mouthguards, can help keep the airways open by repositioning the jaw. Consult with a dentist specializing in sleep disorders to determine if an oral appliance is suitable for you. Seek medical intervention. It's crucial to keep in mind that snoring can sometimes be a symptom of an underlying medical condition. If self-help strategies and lifestyle modifications don't alleviate your snoring, consult a healthcare professional. They can assess your condition and recommend suitable medical interventions, such as continuous positive airway pressure therapy or surgery. And that's all for this video. If you found this video helpful, please give it a thumbs up, subscribe to our channel for more health content, and share it with others who may benefit from it. Thank you once again for watching, and we'll see you in the next video. Sleep well and snore no more.